Hi, good evening. Today I want to talk a few minutes about infectious mononucleosis, commonly known as kissing disease, because it is transmitted by oral secretions. This disease is caused by Epstein-Barr virus, known as EBV. Most of the times it's just a benign disease. It goes off within 2 to 4 weeks, but sometimes it causes complications that stays for your life. Now, I want to talk about the causative agents. As I said, Epstein-Barr virus is the most common cause, but in some cases, Toxoplasma gondii or other viruses or even cytomegalovirus cause this problem. Like 95% of world population gets this disease, and it goes from saliva to saliva, oral secretions, and also in children. This disease is transmitted in various forms, as from oral secretions to contact surfaces, from contact surfaces again to the mouth. So this disease, we call it as the kissing disease because of that importance, because of the mode of the spread through oral secretions. The infection begins in the cells of the oral cavity and spreads to adjacent salivary glands and the lymphatic tissue. Eventually, the virus, it infects the entire reticuloendothelial system, including liver and the spleen. So this disease, it goes into various organs. Starting from mouth, it goes into salivary glands, and then it goes into the body, and it goes into the spleen and the liver. So that's why it's important to, when we think about complications, one of the complications is hepatitis caused by this virus in the liver, and the other is splenomegaly that caused by the virus's activity in the reticuloendothelial system. So this disease, it has 1 to 2 weeks of prodromal period, and in that period all you get is non-specific respiratory symptoms like fever, sore throat, and typical symptoms like fever, sore throat, and muscle aches all over the body, headache, and abdominal pain. Those are the important things. And there is an exudative tonsillitis and palatal petechiae, like as we see in streptococcal pharyngitis. You can also see the lymphadenopathy, cervical lymphadenopathy, posterior and anterior chains, both are infected. Also inguinal and axillary and inguinal lymphadenopathy is also seen in this disease. And finally, the most important thing is splenomegaly. Like 50% of people get splenomegaly, 25% of people get hepatomegaly. And that's why we should strongly recommend patients who get this disease not to engage in any contact sports for at least 4 weeks. And if they have splenomegaly or hepatomegaly, we should make sure that they don't have it. We should follow them with ultrasound, and only when they don't have it anymore should we recommend them to go back into contact sports. Now, if we give amoxicillin or ampicillin to these patients, they develop a rash. That's why when you suspect infectious mononucleosis, don't give ampicillin or amoxicillin. That causes rash in these patients. They have high hepatic transaminases, high WBC counts, and also you will see jaundice in many patients. Now, the diagnosis. The most commonly performed test is monospot test. That's a very important point. The monospot test, in all young adults with whom you suspect this, you should use it. But in children or in people younger than 14 years of age, you should not order this test, simply because the sensitivity is very, very low, like 50%. And also in that prodromal period, you might get many false negative results. That's why it needs a high index of suspicion. Now, as I said, splenic rupture in patients who are active in sports is a very dangerous complication. People get peritonitis and die because of this problem. That's why you should you should advise them not to engage in contact sports. Now, differential diagnosis, the most important thing is streptococcal pharyngitis, because it simply looks like infectious mononucleosis, but you can always do a rapid strep test to just rule out the possibility of streptococcal pharyngitis. So lymphadenopathy associated with mononucleosis is usually more generalized than it is associated with streptococcal infections. That's another point. So streptococcal infections just localized lymphadenopathy, whereas infectious mononucleosis causes a generalized lymphadenopathy. Now, I will say again, the most serious complication is splenic rupture. Their spleen can go into bad shape, and these people can die of peritonitis if they don't get treatment in time. So they should avoid contact sports for at least 1 month, and documented splenomegaly should not return to sports. If the patient has a documented splenomegaly, they should not engage in sports unless they are cleared by an ultrasound. So you should follow them with ultrasound regularly. Now, symptomatic hepatitis and neurologic complications, including meningitis, encephalitis, they can happen, and sometimes even cranial, autonomic, or peripheral neuropathies can happen in these patients. Hemolytic anemia can be seen, and aplastic anemia, and neutropenia, thrombocytopenia, and all these hematological disturbances can happen in these patients. That's why, but thank God it's not in the majority of the patients. Now, treatment is generally symptomatic. If he has a headache, you give some Tylenol or ibuprofen, or if the patient has dehydrated, you will give some IV fluids. If the patient has muscle aches, you give them bed rest. So those are the issues we do. It's just symptomatic treatment, but when the patient has any airway obstruction, anemia, thrombocytopenia, or a severe disease, we can use steroids. So steroids are good in these patients if they have any complications. This disease will relapse in many patients from 6 months to 1 year, but that's a minor fraction. And in most patients, the symptoms will disappear in 2 to 4 weeks. So that's basically about infectious mononucleosis. The most important things you need to remember is monospot test we use in young adults, and also splenic rupture, and the most serious complication, symptomatic treatment, and the differential diagnosis, streptococcal pharyngitis, and medications that are contraindicated include ampicillin and amoxicillin. That's about infectious mononucleosis. Feel free to visit our website www.usmlvideos.net. Thank you very much.